And okay, let me introduce myself again. My name is Yiannis Koumpouros, and in the next few minutes, I will try to illustrate how technological innovations, and more specifically, the mobile health initiatives, can help upgrade health services by studying the case of the COVID-19 pandemic. Healthcare is the industry that leads the technological developments while adopting first the information and communication technology innovations. The complexity and inherent multiple healthcare system components enforce technological progress, technological innovation in order to overcome impediments and failures which slow or inhibit progress in the healthcare sector. The challenges faced are numerous. For example, the exponential growth of data produced, the financial viability of the system, security and privacy issues, the aging of the population, and similar. There is a great need for well-established solutions able to manage effectively the flow of information between the different parties and actors in the healthcare industry. The explosion of new technological solutions, along with the appearance of the next generation, forced to find new ways to provide the healthcare services. COVID-19 is the disease caused by the coronavirus called SARS-CoV-2. The World Health Organization learned of this new virus on the 31st of December 2019, following a report of a cluster of cases of viral pneumonia in Wuhan in China. The most common symptoms of COVID are fever, dry cough, and fatigue. Symptoms of severe COVID-19 disease include shortness of breath, loss of appetite, confusion, persistent pain or pressure in the chest, and high temperature. According to the WHO, people aged 60 years and over, and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, obesity, or cancer are at higher risk of developing serious illness. However, anyone can get sick with COVID-19 and become seriously ill or die at any age. Among those who develop symptoms, about 80% recover from the disease without needing hospital treatment. About 15% become seriously ill and require oxygen, and only 5% become critically ill and need intensive care. Complications leading to the death may include the respiratory failure, acute respiratory distress syndrome, sepsis, thromboembolism, and multi-organ failure, including injury of the heart, liver, or kidneys. In rare situations, children can develop a severe inflammatory syndrome a few weeks after infection. Physical distancing, wearing a mask, especially when distancing cannot be maintained, keeping rooms well ventilated, avoiding crowds and close contact, regularly cleaning hands, and coughing into a bent elbow or tissue are some of the COVID-19 anti-measures. Of course, the WHO, the World Health Organization, commands that we should do it all. As of February 2022, we had around 425 million cases of coronavirus. Of them, more than 6 million people died and around 350 million people recovered. These statistics reveal that the threat we are facing and the importance of taking all the necessary measures to stop the spread of the virus are very important. At present, infected countries rely on active case detection and control, contact tracing, and case and contact isolation. However, several researchers have highlighted the challenges of the contact detection process from previous experience with the Ebola outbreak. These challenges include the contact identification, breach of contact security and privacy, the registration process, as well as increased exposure of staff working on contact monitoring. Moreover, some people may not have a physical address, some may live in rural areas where there are no street names, etc. Thus, contact tracking is not easily achievable. The COVID-19 pandemic has brought about significant changes in all areas of human life, the way we live, communicate, train, work, etc. The rapid spread of the virus, in combination with the significant and unpleasant consequences for human health, has been the trigger for a unique global collaboration in the scientific community to find a solution as soon as possible. At the same time, it has driven technological innovations at a frantic pace in order to support people, communities, and enterprises operate. The unprecedented conditions created led to the need for social distancing and isolation in order to prevent further spread of the virus. In this context, the term tele was added to almost any activity. Telework, teleeducation, and of course telehealth have been adopted in all their forms in order for people and businesses to face the new challenges. Digital skills are now as vital as literacy, and the world needs digitally competent people who are able not only to use, but also innovate and lead in using these technologies. The late adoptions of technology are related products and the related products and services is a trend mostly observed in people who have misconceptions about technology, are technophobic, or lack information technology literacy. People who feel intimidated by these objects are more likely to experience technology anxiety, and frequently the non-tech savvy older population faces a risk of lower quality of life and chances of inclusion. The ability to use digital solutions and tools is a crucial issue because low adaptation to the digital era is a barrier in daily living that reduces quality of life, independence, autonomy, and mental health. Additionally, such tools could effectively enhance medical care in older adults. Fear of technology is prevalent among older generations, mostly who deal with computers, complicated acronyms, or other technologies. The new normality caused significant changes in the maturation of the public, eventually bending technophobia and technological illiteracy. The combination of mobile communications, smartphones, wearables, and the internet has created technological innovations that have come to stay. Mobile health is on the rise, providing important solutions to tackle the pandemic, proving its usefulness in all directions, bringing to the fore many startups. However, issues of personal data protection, privacy, confidentiality of sensitive health data, and many others remain still open in order to support the continuity of healthcare in compliance with applicable national legislation. Big data and artificial intelligence have helped facilitate COVID-19 preparedness and monitoring of infected individuals, and thus the spread of infection in many countries. Tools such as relocation maps, which use mobile phones, mobile payment application, and social media to collect real-time location data on people, initially allowed Chinese authorities to track the movement of people who had visited Wuhan market, the epicenter of the pandemic. With this data, machine learning models were developed to predict virus peripheral transmission dynamics and to guide border controls and surveillance. Let's now look at some examples on how technologies have helped fight the pandemic. As soon as China reported the outbreak, Taiwan began conducting health checks on airline travelers from Wuhan, integrated data from immigration records with the central national real-time health insurance database. This integration has enabled healthcare facilities to access patient travel histories and locate individuals to better monitor and the spread of COVID-19. Taiwan's proximity to China's Wuhan has made the region particularly sensitive to COVID-19, but the efficient use of large amounts of data is credited to the small number of cases and deaths. As contact tracing has become very difficult, the local netizens have marked out potential hotspots for infections on Google Maps. making it easier for people to check if they have passed through those areas during the relevant timelines. There are 3 such maps since May 14, but it has to be noticed that these maps do not carry the imprimatur of the Central Epidemic Command Center of the country. Another example is the one of the World Health Organization, who developed an innovative platform called EpiBrain, the one you can see in this slide, that allows experts in data and public health to analyze large data sets for emergency preparedness and response. Using the latest advances in data and science, machine learning and artificial intelligence, the platform will improve our understanding of the complex factors that drive outbreaks in order to predict and forecast epidemic events such as the COVID-19. The EpiBrain platform allows stakeholders to merge public health data with data on the complex factors drive epidemics, including human and animal population movement, animal diseases, environmental and meteorological factors. Using the platform, scientists will be able to forecast and early detect infectious threats and their potential impact. Additionally, the development of scenarios and simulation exercises will be possible to improve coordinated decision-making and response. Contact detection and warning can play an important role in all phases of the epidemic, especially as part of the containment measures during de-escalation scenarios. At European and global level, the European Center for Disease Prevention and Control and the WHO have asked member states to identify and monitor national contacts associated with each case to stop transmission and, as a secondary objective, to understand transmission potential. Digital tools such as mobile application with detection features can greatly support this process by detecting both known and unknown contacts of a confirmed case. Such functions can help identify more contacts and speed up the overall process, which is essential in this pandemic. In addition, these applications can provide COVID-19 case contacts with information on how to reduce the risk of further transmission and advice on what to do if they experience symptoms. An example of using effectively digital tools is the Go Data platform developed by WHO, which is a software tool for outbreak response and contact tracing. By integrating relevant case and contact data, including laboratories, hospital, and other variables, collected through investigation forms, Go Data generates daily contact follow-up lists and offers a comprehensive visualization of change of transmission of COVID-19. Go Data is freely available for any country or institution to use and provides real-time and complete outbreak investigation data in an intuitive visual form. Thus, it enhances field-level operations and decision-making, as it clearly points out where and how to better direct resources. The tools includes functionality for case investigation, contact follow-up, visualization of change of transmission, including secure data exchange. Go Data has already proved to be a useful tool during this pandemic for Bangladesh response teams, but it can be helpful even beyond COVID-19. Another example is related to Singapore's response, which was one of the first countries to introduce digital tools to combat COVID-19. On the 20th of March 2029, the Singapore government released a Trace Together app in order to support existing nationwide efforts to combat COVID-19 by enabling community-driven contact tracing. You can watch now a short video on how this app works.
Dear Singapore, we want to live life normally, as safely as we can. But fighting COVID-19 requires all of us to play our part, and here's how. 1. Download Trace Together and help those around you to set it up. 2. Turn on your Bluetooth and keep your app open in the background. It is as simple as that. Get peace of mind for you and those around you through community-driven contact tracing. Trace Together helps contact tracers identify and get in touch with you quickly if you had possible exposure to COVID-19. So how does it work? Trace Together uses Bluetooth signals to determine when your phone is near another phone that also has the app installed. Both phones exchange anonymized IDs, which are then stored in encrypted form only on your phone. If a user tests positive for COVID-19, the anonymized IDs can be used to help contact tracers quickly identify and contact people who are at high risk of infection to provide guidance and prevent the spread of the disease. Take this time to 1. Download Trace Together and help those around you to set it up. 2. Turn on your Bluetooth and keep your app open in the background. The more people on board Trace Together, the better we can contain COVID-19. Trace Together, safer together. Dear Singapore.
Another interesting example is the case of South Korea. South Korea has implemented contact detection tools using security camera footage, face recognition technology, credit card transactions, and GPS data from vehicles and mobile phones to provide mobile real-time data and detailed travel schedules for the population. South Koreans receive emergency alerts for new COVID-19 cases in their area, and those who could come into contact with confirmed cases are informed to report it to testing centers and isolate themselves. As you can see in this slide, there are very detailed data on the person's movement. Of course, it seems unlikely that such methods would prove acceptable in European countries, where there is an ongoing debate whether a contact tracing app that stores some data centrally poses a threat to privacy.
With the Corona Warn app, you can
another example is in Germany.
With the Corona Warn app,
let me pause it for a moment. Okay, another mHealth application, the Corona Warn app, helps to curb the spread of COVID-19 by documenting the digital encounter between two smartphones. This allows the app to quickly inform the person if he had contact with a person diagnosed with COVID-19. This is the official federal government app, which serves the protection and health of the community in Germany. Let's have a look at the video to see how this app works.
With the Corona Warn app, you can help to interrupt chains of infection with minimal effort and with maximum data protection. The Corona Warn app does not know who you are, but it can accompany you so that you can better protect yourself and the people around you. Whenever you encounter another user, your smartphones automatically exchange encrypted random codes. These random codes tell the smartphones that people have encountered each other, for how long, and how far apart they were. They disclose neither names nor locations. The other user will therefore never find out their smartphone has exchanged a code with yours. Your identity will remain secret. The codes are deleted from your smartphone after 14 days. If it is proven that a user has been infected, they can choose to anonymously make their random codes available to all other users, and to you as well. Your app finds the code that your phone exchanged with the infected person's smartphone and informs you that you came into contact with them. At the same time, it provides you with clear recommendations for what to do. You will also remain anonymous at all times. The successful fight against the coronavirus can only be won if we work together. You can play your part too. With the Corona Warn app, you protect yourself and those around you.
Another mHealth application, as you may have noticed, this approach is totally different from the previous one. One of the key messages of the video was the protection of sensitive data during the whole process, which seems to be essential for most of the users nowadays. Mobile apps have also tested in China to dictate whether a person should be quarantined or allowed into subways, malls, and other public spaces. Using the IPHC code, users are assigned a color code, green, yellow, or red, that indicates their health status. However, after an in-depth analysis of the software's code by New York Times, it was found that the system not only decides whether someone poses contagion risk, but also shares information with the police. This, as you can imagine, poses questions on issues related to automated social control that could persist long after the epidemic subsides. In Taiwan, online tracking of quarantined people is facilitated by government-issued mobile phones tracked by GPS. In case of violation of quarantine, this so-called digital fence activates the messages to the person and imposes fines. In South Korea, on the other hand, people in self-isolation are required to download an application on their mobile phone that notifies authorities if they leave the place of isolation. Finally, in Hong Kong, people in self-isolation are required to wear a bracelet collected via cloud technology to a database that notifies authorities if quarantine is violated. Telecommunication providers in several countries have started to share call data records based geolocation data with governments in an aggregated anonymized format. For example, Deutsche Telekom is providing anonymized mobile flows data of its users to a research institute and government agency responsible for disease control and prevention. Vodafone is providing some governments with large anonymized data sets to help authorities better understand population movements. And the European Commission is currently liaising with 8 European telecommunication operators to obtain from them anonymized aggregate mobile geolocation data in order to coordinate measures tracking the spread of COVID-19. Facial recognition, in some cases combined with thermal imaging and AI, has been used successfully in a number of countries to monitor the spread of COVID-19. For example, in China, facial recognition has been used to prevent citizens who may be infected with COVID from traveling. This technology can identify successfully people even when they are wearing masks. Moreover, in the Russian Federation, facial recognition is used to track persons who do not respect quarantine. It is easily understandable that the use of biometrics raises a number of privacy concerns. Additionally, an informed and explicit consent should be required from the end user. As you can see from what has been presented so far, there are still several open issues related to the use of the provided technologies. For example, location data collected from mobile phone via GPS, cellular networks, and Wi-Fi can monitor population flows in real time, identify potential virus transmission hotspots, and provide information on the effectiveness of public health interventions. Of course, access to mobility data is a major challenge, and these approaches have raised ethical and confidentiality issues. As already mentioned, anonymous private data have recently been made available by several telecommunication companies for the purpose of COVID-19 control. However, this data is limited and there is no longer commitment to share it. On the other hand, the QR code serves as a health certificate for COVID-19, but also as a travel pass with color codes representing low, medium, or high risk. People with green codes are allowed to travel without restrictions, while people with red codes are required to self-isolate for 14 days. Other applications based on self-reported surveys, such as those used in QR code systems, only work when individuals are symptomatic and report their symptoms accurately. Moreover, telephone quarantine solutions can be bypassed if individuals leave the quarantine facility without their device. Finally, contact tracing applications also have several open issues. For example, no quarantine is required on all contacts, such as when exposed persons wear personal protective equipment or are separated by thin walls pierced by mobile phone signals. These are only some examples on the gaps of the used technology that should be carefully considered during the development phase. Following what has been said previously, privacy by design is required to deliver an appropriate application that serves both the government and the end user. the use of anonymized or pseudonymous data and their deletion once its purpose is served are some action in this direction. Moreover, encryption techniques can provide added security. Moreover, compulsory use of the app by employers, shops, or other persons is contradictory with the principles of the EU General Data Protection Regulation. Any app should be neither intended nor suitable for the purpose of restricted access to facilities. The protection of the user's privacy should be a top priority. It is obvious now, I believe, that digital technologies provide for sure powerful tools for fighting pandemics, but several ethical and privacy concerns are inherent. Transparency and privacy by design are critical in order to engage the wider population in using the developed apps. In this regard, governments and developers should consider a number of issues, such as the legal basis of the use of these technologies and the quality of the data collected. Moreover, the public have to be well informed, and any efforts should be implemented with full transparency and accountability. Finally, data should be kept only for a limited period of time and should be deleted after serving the specific purpose for which they were collected. I hope I have given you a complete picture of the use of technologies for fighting pandemic, as well as the important issues arising from the use of the same technology. Thank you very much for your attention. I would be more than glad to answer any questions you may have.